Hello, I'm Zachary, active duty Air Force 4-0. I'm going to be teaching you proper placement and insertion of an intraosseous device. This takes place in the tactical field care phase when you encounter a casualty that has significant injuries, altered mental status, absent radial pulses, and requires fluid resuscitation. You have already attempted 2 peripheral vascular access attempts that have been unsuccessful and require IO to administer fluids and medications. Take body substance isolation. First, gather, prepare, and inspect equipment. Next, spike the IV bag and properly prepare the IV tubing. Assemble IV infusion fluid and tubing using the aseptic technique. Locate the proper site for easy IO insertion. Prepare manual IO needle by removing the needle safety cap. Make sure you keep your hands and fingers away from the needle. Position the needle at the insertion site with the needle at a 90-degree angle to the bone surface. Now gently pierce the skin until the needle tip touches the bone. With consistent, steady downward pressure, twist the needle back and forth until you penetrate the bone cortex. An obvious give should be felt. Unscrew the stylet counterclockwise and remove the stylet from the catheter. Connect the primed IV tubing to the exposed luer lock hub via 90-degree IO tubing. Draw back with the syringe plunger slightly, looking for fluid from the marrow cavity to mix with the saline. Inject 5 to 10 milliliters of saline, observing for signs of infiltration. If there are no signs of infiltration, clamp the extension tubing and remove the syringe. Attach the IV tubing. Open clamps on existing tubing. Set the flow rate. Next, secure the site with IO stabilizer or bulky dressing and tape. Administer IV fluids and/or medications as needed. And remember, document all findings and treatments on a DD Form 1380 TCCC card and attach it to the casualty.